Hi, this is Matthew Hansen. I'm here today with Sam Meisels, the founding director of the Buffett Early Childhood Institute and one of the foremost early childhood experts in the country. Thanks for joining us today, Sam, and we're going to talk about a really important topic today, which is sort of children during COVID-19 and how you open or reopen a child care or early childhood program during this obviously scary time. So let's get right to it. First question, if you look through the eyes of a child right now during COVID-19, how do they kind of view this situation?
Matthew, you used the word scary just a moment ago, and that's one of the ways that the children look at the situation, I believe, through their eyes. Different ages of children from different circumstances, they are going to have different perceptions. And a lot of it has to do with, of course, the environment in which they are living every single day. So if there's someone who's sick in their home and is being quarantined in the home, and they have to stay away, that's going to be a big influence on how they feel. But even if everyone is healthy, still there are things you can't do, which in the past you could do. You want to see grandma, you want to see grandpa. You can't do that anymore. You can't see your best friend. You can't see your teacher. You can't go to school. There's so many things you cannot do. You even can't go outside at various points in all of this. And when you do, you have to stay at a distance from people. So in some respects, lots of the things we've been teaching children about how to be social, how to be friendly, how to make friends, how to engage with others, you're saying, no, don't do that. And why not? Because you might become sick. So it's not a good story, and it's a tough thing for kids to adapt to.
In order to try to help, the Buffett Institute is releasing a list of guidelines, 10 that are, they're simple. It's one page. Child care centers, anybody who's caring for children can look at this and, hopefully run their business in a way that is as safe as possible and also kind of as caring as possible for kids right now. What do you, when a child care provider or somebody who cares for children asks you, how do we do this right now? What are the sort of best practices, the guidelines to open or reopen? What do you tell them?
Sure. Again, you use two very, very important words: safe and caring. Safe and caring is what we want. I mean, for all child care programs of any sort, any size, this has been a painful and difficult time. This is a time when you want to help other families, where you may be financially unable to survive, as in this enterprise, if you close. And at the same time, by being open, you're bringing parents to a single location, and you're bringing children to that location. And is there a possibility of transmission of the disease? And the answer is yes, but we don't know really how extensive that is. Children, it's still being looked into and carefully researched whether children can transmit, and actually become ill from the virus. But it's not nearly as much of a risk as it is with adults. In any case, what you do with adults is you wash your hands, you keep a safe distance, and you be sure that if someone is ill, that they isolate themselves. And you also will probably wear a mask. Now, washing hands is certainly feasible with all kids, but a safe distance, we say infants don't social distance. Actually, I don't think any of the kids in preschools social distance. We can ask them to, but it becomes confusing, and it's not something they're expecting to do, and they'll have a lot of trouble doing it. Wearing masks should not be done with children 2 years of age and younger. It's not safe. Wearing masks for older children is like probably going to spend most of your time trying to fix that mask on the child's face. So this is it's complicated to use adult rules in children's lives, and this is one of those cases. But we have offered 10 different steps that you could take, and we think that they will help. What you must do is look what your Department of Public Health is saying, your local Department of Public Health. You also can get good information nationally from various sources. Like the CDC, and you want to be sure that you are not placing any child in harm's way in terms of their health.
I guess to summarize, what would you tell parents, families, teachers, concerned adults about what children need during this sort of, difficult in our lifetimes, unprecedented time?
If I were the preschool teacher, and one time in my life I was, if I were the preschool teacher, before the child started back at preschool, I would have a conversation with a parent. And I'd say, tell me how it's been for the last 10 weeks or 12 weeks, however long it's been. Have you been working? Has someone else been with the child? Has the child been with you? What's the child's mood like? All of that kind of thing. So you have a sense, and you're not starting from scratch. We know that this isn't as if the child was out for the weekend and came back. It's not business as usual. It's going to be different. I think class size, group size should be small. We should recognize that what is really important is the strength of relationship between each child and a caring adult. And caring is the watchword. It needs to be very, very comforting and safe. Recognize that children may act out a little bit. Some of them haven't been around a group of children, maybe not any child, or more than one or two, with their siblings, for this entire period of time. So it's difficult. Recognize that, and for yourself too. You too have been under stress, under pressure. So support one-to-one, different age children. The younger the child, the more they will need that. And be gradual. Take your time. Explore. See what works with this child, and maybe not so much with that child, but what works with that child. It really is starting from a new place, a place that, as you say, is unprecedented, and unprecedented for yourself. Remember your own needs in this too. And I think that we'll get through this, but it will take some changing, and it will take time.
Thanks a lot for answering my question, Sam. Obviously, the Buffett Institute wants to help, can help in this case. We're going to put the guidelines, where you can find the guidelines, up on your screen here. And thanks again for sharing your expertise today, Sam.
Thanks. My pleasure talking to you, Matthew.